Hi, and welcome to one of the 3 short courses on the Birthing Better Childbirth Preparation skills. I'm the director to Common Knowledge Trust and had the privilege of developing these skills in the early 1970s and 80s with hundreds of families just like yours. And now I'm the director of Common Knowledge Trust in New Zealand. This course, the short course on the skills, is about the soft skills that we needed to develop as families. A lot of people can understand, well, breathing skills, those are sort of like the practical skills. Most people don't understand the bodywork skills that we offer in another short course, but those skills are practical. You can feel them, they're tactile or they're experiential. But a lot of the soft skills are both how we work through the skills, how we work together, and how we use the skills in different scenarios and circumstances. So let me tell you about what this course is going to have. Now, yes, you could have gotten the bigger course, but here you are and you've bought this one. So go through with it, and if you want to buy the other 2 short courses, you can, and then you'll have all the skills. So what we first want to do is to really introduce you to the importance of being as skilled as a mother-to-be and as a father-to-be. So we have an ebook for each of you. A lot of the books for fathers in pregnancy, maybe they give a few paragraphs or a few pages, but because dads develop these skills as well as mothers, it's really important for you to understand that these skills are equally for you because they were developed by both of you as mothers and fathers. So we have an ebook for both of you. Then we have a number of ebooks that really talk about the type of birth that you will end up having, whether you've planned it or not. You could have planned a vaginal birth and had labor in a vaginal birth, or you may not have planned it and had that anyway. You may have planned a vaginal birth, had a labor and wanted a vaginal birth and ended up with an unplanned surgical birth. You may have wanted an unplanned surgical birth, or you may have wanted to have a vaginal birth after a previous cesarean, or you may have been just traumatized by your birth experience. So we have an ebook for you to look at for all of those situations so that you understand that these skills were developed for all of those types of births. We also have an ebook on making 2 birth plans. This is really important. When I gave birth in the 1970s, there were no choices, so nobody made a birth plan. But there were skills, Lamaze and the Bradley method. But those were techniques and they didn't work as well for many people as they had hoped. And they also had a philosophy behind them, which was to achieve a normal, painless, less medical birth. And often women didn't achieve those things. So they went out of date and choices took their place. But birthing better skills developed at the same time. They were like the evolution of the skills-based approach to childbirth. And you get to benefit from that evolution because now we've had a generation of people making birth plans and often they don't work. So what's left? Well, skills work. They are the foundations. We just can't attach them to a philosophy. The philosophy we have to attach them to is you're pregnant and 100% of you will give birth. And birth is an activity that you have to do. And if you do that activity with skills, that's how you feel empowered. You feel empowered by your own behaviors, not necessarily what other people do or don't do for you. So when you make a birth plan, it's really important that you do talk about the things you want and you don't want because your birth professionals need to know that. But you need to make a birth plan that's based on the skills that you're going to use. Now that may only be your cheat sheet. You may take that with you to the birth to go through the list of skills to remind yourself. But on the other hand, you also want to say to your birth professional, these are what we're bringing. This is our responsibility. We are going to bring our skills to our baby's birth. And you want them to encourage you to use your skills. That's really, really important. So we have an ebook that teaches you how to make a skills-based birth plan. Then we have an ebook about the 3 roles in childbirth. I know at the one hand, women know they're the ones that are going to give birth. Without a doubt, you know that. But really, There's a belief my midwife will take care of me, my doctor will take care of me. And from the father's viewpoint or the birth coach's viewpoint, she knows what she's doing as a birthing woman and they will take care of her. Well, that's all good, but you are doing the birth. And your birth coach, your partner, your other, has to help you navigate through everything that's happening to and around you. So you really need to understand that each role in childbirth has designated skills. Sadly, you've lacked the skills in the past, and now we're giving them to you so that you can use the skills in your baby's birth. Then we want you to really understand about birthing behaviors. There is a really just let's see 2 tables of positive birthing behaviors and the stressful ones. Simple as that. Do more of the positive, use less of the stressful. And as a birth coach, that's your job. Your job is to help the woman stay in the positive column. And it's really hard when you're doing the birth to stay there because moment to moment the internal sensations change. So it's really good. And you can bring that with you as well so that you understand what you're seeing and what you're hearing, what you're feeling and what you're doing. So it's really, really important that you have an understanding of the birthing behaviors. Then there's an ebook on teamwork. You don't know anything about teamwork until you really have had to work through challenging experiences. And birth is a challenging experience, even though it may be pleasurable to you. And if it isn't pleasurable, it's more challenging. Or if things happen to and around you you didn't want or didn't expect, it's more challenging. So you need to have great teamwork. Then we offer you the soft skills around tension and relaxation, and the hows and whys of pain. And then how to work with pain. That's a big one. So there's often a message out there that you should trust birth and you'll innately know what to do with it. Yeah, well, you will birth because 100% of pregnant women will, one way or another. So you can trust it or hate it. You can love it or fear it. Doesn't really matter. You need to often cope with discomfort or downright pain, and pain you may never have experienced before in your life. So there's a video segment on the 4 types of tension, and there's a video segment on how to manage the tension. And so we have given you, wrapped up into one short course, all of the soft skills of the Birthing Better Childbirth Preparation system. And it's really important that you understand that these skills did come from families like yourself. And they nitpicked at everything. They wanted to make certain that there was a skill for everything, every little thing, from what they thought to what they experienced to what happened to them around them, and from the viewpoint of the birthing woman as well as from the birth coach. So we're glad you took this course, and we're really glad that you're part of the Birthing Better family. See you later. Bye-bye.